Hi, I'm Dr. Stefanie Carnes. I'm the president of the International Institute for Trauma and Addiction Professionals, where we train certified sex addiction therapists on how to provide therapy for sex addiction treatment. And our mission at ITAP is basically to provide compassionate and effective treatment for couples and their families struggling with sex addiction. And what I'm going to be speaking to you about today is how to deal with the very difficult issue of how to talk to your children about this issue. So if you are a couple that's facing sex addiction and been struggling with this in your family, you might be wondering, what do I tell my kids about this? What's appropriate? And so I hope to answer a few of those questions today in this video. Now, therapists look at a lot of different factors when thinking about what type of information to share with children, and usually evaluate this on a case-by-case basis and really want to work with the parents. Now, as parents, you know your children best. You know what they understand. You also have a better understanding of their developmental maturity level and what's going to be comfortable for them. So it's really important that the parents be comfortable with any decisions around what's shared with their children, so that they can feel really good about those decisions. So there are many factors that therapists take into consideration while looking at these issues. The first one is developmental maturity. We always want to make sure that the information that we share with children is at it's sort of pitched at the appropriate level of maturity for the child. Now, you have some children that are 12 going on 25, and you have some children that are 25 going on 12. So you really want to consider their developmental maturity level when thinking about how to explain this to them. You also have to consider what information they already know. Now, I've worked with families and some cases in which the children are already very privy to all the information. For example, situations in which the information is public, or perhaps the child made a discovery and learned about the process. For example, I worked with a 12-year-old who, when he was 9, he learned that his father, who was a sex addict, was using porn on his computer and actually had prostitutes in his room. And so for him, that was a very obviously traumatic and difficult thing to process. And so sometimes when the children are privy to a lot of information, that can be traumatic for them, and they need some supportive treatment as well. So looking at what do they already know, sometimes we have to provide a rationale for them for what they already know. The most important consideration in thinking about what to tell a child is to really evaluate what is in the child's best interest. Sometimes, in the heat of conflict, marital conflict, sometimes we want to share with children, and we want them to know information about what the addict did or what the partner did to help explain things. But some of that information may not be really in the child's best interest. So we always have to really consider what the child's best interest is. We don't want to triangulate children and pull them into parental conflict. And so it's really important not to involve the children in arguments between the parents or information that is not developmentally appropriate for them. And that can be very tempting in a situation where there's a lot of marital conflict. So what I ask parents to do is to try and rise above the tensions that they have between one another and really consider what's in their child's best interest. It's always important for children to have permission to love the other parent and to have a relationship with the other parent. And when children are triangulated into parental conflict, really what that's asking them to do is to side with one parent or the other. And as much as we can avoid doing that, it's important to do that. So I encourage parents not to overshare with children. Sometimes when parents are distressed and struggling, sometimes it's tempting to rely emotionally on children for support and share information with them that really it's not in their best interest to know. So we want to keep healthy boundaries with kids and protect them and allow them to love the other parent and really keep them out of the marital arguments as much as we possibly can. So we look at different types of disclosures to children. I wrote about this in my book, Mending a Shattered Heart, in Chapter 9, which is What Do I Tell the Kids? So for more information, if you'd like to read more about this, you can read about it in Chapter 9 of Mending a Shattered Heart. But I look at different types of disclosure to children. So the first type is a forced disclosure. So a forced disclosure is a situation in which the child is going to find out about the disclosure from some sort of non-nurturing means. So the addict is going to be on the 6 o'clock news, or it's public information, or they're going to find out because everybody in the neighborhood knows, or their friends know, or something to that effect, or somebody's going to tell them. And so often these disclosures are the most difficult situations because sometimes you have to share with children information that is really not appropriate for their age level, or information that we'd really rather protect the children from. And unfortunately, there's really nothing that we can do if this information is going to come their way other than provide them a more supportive environment to hear it in and support. And so, having, for example, the addict that engaged in the behavior invite the child to therapy and share in a therapeutic environment what has happened in a more nurturing way, so that the actual discovery in that moment of learning about the information can be done in a more supportive fashion. So those forced situations are some of the most difficult situations that are out there. Now, I also coined the term a softened disclosure. A softened disclosure process is when we share information with the child that is geared towards their age level, what is appropriate for them to know given their age level, and it's explained in terminology that's appropriate given their age level. So I'll give you a few examples. I have a colleague who she's in recovery from sex and love addiction, and her acting out involved repeated affairs and many affairs, and one of them was with the children's friend's father. And so they learned about this this behavior. And in this, her explanation to the children was, mommy has a boyfriend. mommy's not supposed to have a boyfriend, daddy's supposed to be mommy's only boyfriend. So I want you to know that mommy is severing this relationship. I'm fully committed to daddy, and we're working on this, and I don't want you to worry about what you've learned about. That type of information. So it's pitched in language that the children understand. In another case that I worked with, another softened disclosure situation, the children had, small children had found pornography that was left out on the addict's computer. So in that instance, the addict explained to the children, daddy was looking at pictures on the computer of people without their clothes on. This is not within daddy's value system, and I'm so sorry that you saw that. I really regret that you saw that. And we're going forward, we're going to be putting filtration software on the computer so that that doesn't happen again. And he went along to explain his values and went into that further with the children. So you can see how that information is pitched in language that the children understand. So that's a softened disclosure. A softened disclosure usually does not include the words, I am a sex addict. For younger children, that can be confusing. Children really don't grasp abstract thinking until they're 12, 13 years old, and so sex is an abstract concept for them. Addiction is an abstract concept for them. So the idea of sex addiction can be quite confusing for younger children. Now, another type of disclosure is a delayed disclosure. So delayed disclosure is when the parents share at a later point in time about the addict's recovery process when they feel the child is old enough and mature enough to understand addiction and recovery and what they're doing. And usually a delayed disclosure is oftentimes anyway shared information with the children so that they can understand that they have addiction in their family history, and they get to know the parents better on a more intimate and connected level and understand their recovery process. And so again, thinking about that is in the long term being in the child's best interest that they have that kind of information about their family history. So often this is done at a later point in time when the children are 16 or 17, and in a delayed disclosure, usually it is shared with them that the addict is a sex addict, and that terminology is used. And some people decide to wait until, given the developmental maturity of the children, may decide to wait until they are adults, and young adults. I usually do encourage addicts to share with their adult children their recovery, that they are involved in recovery. This allows their children to know the history of addiction in their family, and for hopefully the addict to get some support around his recovery process from the family members. So whenever considering disclosure, the message should really be crafted so it's developmentally appropriate for the child. And sometimes this can be difficult when you have multiple siblings and they're at different ages. So if you have siblings that are close in age, I usually recommend crafting the message for the age of the youngest child, because most of the siblings will share information. I often say that siblings are the information superhighway, so they all often share information with one another. And so keep that way you can keep the information consistent and appropriate for the child's age level. So you may be wondering, well, how is this information usually shared? So ideally, it's best if both parents strategize ahead of time about what information is to be shared and have some agreement about that ahead of time. And usually the disclosure will come from the addict. It's important for that addict to take accountability and ownership and model those kind of behaviors for their children. And we usually recommend that the partner be present if possible. Now, it's important if the partner is present that we're, in keeping in mind that it's important that the child's best interest is always in the forefront. It's important that the partner be able to not take, be sort of able to be beyond the trauma in that moment of learning about the addiction, take a sort of a non-victim role and be in kind of a supportive role during that disclosure process. It's very disconcerting for children to hear about the betrayal of the partner, and so they will tend to want to they will be very concerned about the partner, and so we want to not engender too much caretaking and feelings of anxiety on the part of the child for the partner. So if the partner can kind of stay in a supportive role of the disclosure and keep that in mind during the process, I think that's important. It's important too that in this process, if the child demonstrates some distress or confusion around this, and it can create some confusion for a child, that they be provided some therapy. So for example, a child might be confused around sexuality or what this means for them. They might be confused that they might become a sex addict, or that the addict might be attracted to them, or that around their safety issues. They might have a lot of feelings of anger towards the addict, or shame around this. And if they're having or feel pulled into the marital dynamics, if any of this is happening, I recommend that the child get their own therapist and have somebody that they can talk to in a supportive way about this, because it can be confusing for them as well. Now, I recommend that no detailed information be shared with the child, that the behaviors be spoken about in generalities. Children don't like to think about their parents as sexual beings, and learning about details around sexual behavior, it's just really not appropriate for children. And so I recommend that parents set a boundary around that. Now, we do talk about, for family members, honoring their need and desire to know. So if they have questions around the behavior, we certainly would want to be able to answer the child's questions, and be able to provide that information. In my experience, children don't want a lot of, have a lot of questions or want to have a lot of details around the behavior. We really recommend that the information that children be given be consistent. So if the information is shared with one child that are close in age with another child, that information be consistent, that it's consistent over time. And we also recommend a lot of consistency just with behaviors and routines. When this type of thing is happening in the family, I don't recommend, changing schools, changing, moving if possible, trying to keep custody, the situation the same. Keeping routines consistent can provide stability for a child. That kind of structure can be very helpful. So also I recommend that the dialogue be kept open. So we don't want to share this kind of information with a child like your father is a sex addict and then we never talk about it again. So we want to be able to come back to the dialogue and allow the child to have questions at a later point in time and keep it kind of an open discussion. The other thing I think is important when talking to children is sharing, if the addict does share that they're in recovery for sex addiction, that they be open about their recovery process. This can be reassuring to the child that this is being handled, that they don't need to worry about it, and so that the person is in recovery and taking care of the issue so that they don't need to be concerned about it. So, ideally, from a timing perspective, ideally disclosures are done after the addict has been in recovery for a while, can demonstrate that they've had some changes in their behavior and have been, consistent with their recovery. That can be really important. Now, for healing of the child around this, sometimes it's important for them to be able to express any feelings that they have around this to the addict. Sometimes I'll recommend to a child that they write an impact letter to the addict, communicating their feelings about how this has impacted them, and really shared with them how they feel about it. And it's important for the addict to hear that, and it's important for the child to be able to express their feelings. And this is often done with the guidance of a therapist, and helps promote also when the addict takes some accountability around that, can really promote forgiveness and healing in the relationship between the parent and the child. And it may be appropriate for the addict to make amends to the child over time if the child was really hurt in some way as a result of the addictive behavior. Also, the addict can just provide living amends to the child. Living amends is just being different in a relationship, engaging in the child differently, being more involved with the child emotionally, being more present in the relationship, going to the child's baseball games and their ballet performances, and just being different in the relationship, being a more invested parent going forward. And that can be an important part of the healing process with the child. So, in closing, I would just mention that as we discuss all of these things, it's really helpful to talk through this with a therapist, get guidance from a therapist when deciding and strategizing about how to approach this with your children, and really evaluating, again, what's in the child's best interest. So I hope this has been helpful. Please subscribe to our YouTube channel. We'll be putting out more videos about sex addiction recovery and healing for the families. Thank you very much.